Yes, my name is Cheasty Anderson.
Cheasty, thank you.
Cheasty, yeah. I'm with the Children's Defense Fund, and I wanted to thank you for the opportunity to testify on these proposed tax cuts. As Patrick just told you, we are distressed that the House is considering such deep reductions to its revenue stream. And I wanted in particular to address the issue of the current health care crisis that we are standing on the brink of in Texas. Instead of discussing tax cuts, we should be talking about how to use the money we have to shore up the foundations of our healthcare systems. It is impossible economically for Texas to continue on as before without utilizing federal Medicaid dollars that are rightfully ours or shoring up with state GR the healthcare infrastructure that we currently have. The stability of our healthcare infrastructure depends upon this. Already we are seeing accelerated closures of rural hospitals and clinics. 10 have closed in the past 24 months, and another 15 rural hospitals are projected to close in the coming biennium. In addition, we are seeing increased strain on our urban public hospitals. The burden of this funding deficit falls on local taxing authorities and ultimately on homeowners. Recently in Graham, Texas, the city had to raise local property taxes in order to keep their health clinic afloat because their funding streams from both the state and the federal government were so reduced. In the aftermath of this tax hike, many retired homeowners were forced to sell their homes. The solution, using state funds to draw down a 90% match, is within our reach, and yet our state is more focused on tax cuts. If we look at this on a county-by-county basis, it becomes even more apparent. We have a tool, the CPPP has a tool where you can look county by county to see exactly what the data would be if we chose to draw down available healthcare funding. And I selected for my testimony Brazoria County, which is in Chairman Bonin's district. In Brazoria County, there are over 17,000 uninsured constituents. The homeowners in this county pay almost $20 million every year to offset the cost of uncompensated care for those 17,000 uninsured. Accepting federal health care funding would dramatically reduce the number of uninsured in Brazoria County and would relieve the pressure on those local taxpayers. Those savings could then be redirected to much-needed support for schools, roads, or other local community needs, giving tax cuts to businesses and reducing sales tax so that residents of Brazoria County and the rest of Texas see a savings of only $150 a year does nothing to help them keep their essential healthcare infrastructure ready when they need it. Texas happily accepts federal funding for any number of budget priorities, from public education to roads and bridges and disaster relief. Why then, when we are faced with 1 million working Texans who cannot afford health insurance, when medical bills are the #1 cause of personal bankruptcies, when rural hospitals are closing, leaving victims of heart attacks and mothers in labor with potentially hundreds of miles to drive for medical care, why would we reject federal funding in this one area? We should not be discussing tax cuts when we stand on the brink of a healthcare crisis. Instead, we should be focused on creating a healthcare system worthy of the Lone Star State and responsive to the needs of our people. CDF thanks you for the opportunity to testify, and I stand ready to take any questions.
Thank you very much for your testimony. Members, do we have any questions for Ms. Anderson? Appreciate you being here. Thank you for being part of the process.
Thank you.
You're welcome.